agreement on pre-authorization. We brought together 80% of the insurance industry, which has agreed to, for 80% of diseases and injuries, to give immediate pre-authorization so that when you go to your doctor's office and he prescribes you a new knee or whatever it is, you will immediately know whether your insurance company is going to pay for it. This is an historic agreement. People have been trying to do it for decades, and we, because of your leadership, brought the insurance industry together and got them to voluntarily agree to do this. Similarly, we made another historic agreement with personal health records. The 60 biggest tech companies in our country have all agreed to allow Americans for the first time access to their personal data, which they own, which these companies have been monetizing without permission. You're going to be able to see by next year all of your health records on your cell phone. It's going to save lives. It is going to fuel an infusion of technology into that space where people can access those records. They can compare their diet to what they personally need, and we'll have personalized medicine. We are doing price transparency. You passed this during your first term, and then the Biden administration refused to enforce it. We've now brought at HHS, under your leadership and my leadership, more enforcement actions than during the entire 4 years of the Biden administration. So we're going to have that kind of price transparency. I'm working with Linda on forcing medical schools and the MCATs, the people who administer the MCATs, the people who do accreditations, to put nutrition into medical school education. Right now, 25% of the doctors in this country do not feel competent to give nutritional advice. 70% of diabetes cases can be reversed or ended if you just change people's diets, and the doctors don't know how to advise it. They only know how to prescribe the drugs. We're going to change that, so if you come out of a medical school under the Trump administration, you are going to know about diet.
That's great, Bobby. Bobby, autism, if I could just, I don't want to go too long because we have a lot of people, but the autism is such a tremendous horror show, what's happening in our country and some other countries, but mostly our country. How are you doing on that?
We are doing very well. We will have announcements as promised in September. We're finding certain interventions now that are clearly, almost certainly causing autism. And we're going to be able to address those in September.
It's such a big day. I'm looking forward to that day because there's something wrong when you see the kind of numbers that you have today versus 20 years ago. And those numbers, what are those numbers, Bob?
In 1970, the biggest epidemiological study in history was done in Wisconsin. They looked at 900,000 children, and they were looking for autism. They knew what it looked like, and they were very, very precise about it, and they found an incident rate of 0.7, in other words, less than 1 per every 10,000 children. Today, our most recent numbers are 1 in every 31 kids. It's probably actually much worse than that because California, which has the best collection system, is reporting 1 out of every 19 children, American children, has autism, 1 in every 12.5 boys. So it's gone from less than 1 in 10,000 in 1970 to 1 in 12.5 boys today.
Those numbers. So there has to be something artificially causing this, meaning a drug or something. And I know you're looking very strongly at different things, and I hope you can come out with that as soon as possible.
We will.
So 1 in 10,000, and now it's 1 in 31 or 34 or 12 if it's a boy. Can you imagine that? 1 in 12. That's for a boy.
1 out of every 12.5 boys.
It's not even believable that that could be. And that was 1 in 10,000 not so long ago. I've been hearing these numbers, and they get worse and worse every year. There's got to be something. I think there's nothing, including favored nations and everything else, there's nothing that can be, if you can find out the reason that that's happening, and I know we're gonna do some things. I think we maybe know the reason, and I look forward to that press conference, to be with you in that press conference. That's going to be a great thing. Thank you, Bob. You're doing a great job. Linda, how about it? One other thing, and that's medicine. The cost of medicine all over the world is much cheaper than the United States because for years the world pushed us around, including our friends. And you go to Germany, you go to England, you go to different places, and you go to a store, and it's sometimes 10% of what we pay in the United States because they said, nope, we're not paying any more. You charge the United States. This went on for 25, 30 years. And I invoked favored nations. I said, I want to pay the same as they're paying. And Bobby Kennedy is doing a good job, and Dr. Oz is doing a good job. And I asked them, I mean, other than the basics that they're doing on autism and other things, which we got to solve that problem because it's crazy what's happening, it's out of hand. But this is the most important thing that can be done is favored nations, Bobby. And we're not talking about a 25% cut or 50, we're talking about a 1,500% cut. Because people go to Europe to buy drugs and they come back with drugs, prescription drugs, normal, not, I don't mean the bad drugs, I mean prescription drugs. Because you can buy them for 10%, 15%, 20% of what. So they're going to go up in price. And I told the countries, and I get along good with all of them. I mean, you could ask I get along good with all of them. But I said, you know, I told them, I said, you're going to go up a little bit because it's the world. It's the world. So more people in the world than we have. We're going to go down a lot, and they're going to go up a little. And it's called equalization. We're going to have equalization. So we pay the same price as the lowest drug sold anywhere in the world. And I think, Bobby, that's going to happen pretty soon. The companies are ready for it. They had to go for years. I was with a very great gentleman from Eli Lilly. I think he's an incredible executive. I mean, I'll mention the company and I'll mention him because we had this argument my first term, and then we had it in my second term. And my second term, I wouldn't stop until I won the point. And he threw up his hands. He says, you're right, I can no longer defend it. I can no longer defend that a pill that's made by Johnson & Johnson in a factory, in the same factory, in the United States versus a place in Europe or other places, including Canada, by the way, you could buy it for 10% or 15% or 20%, the cost of what we're paying. Where we'd pay 5, 6, 7 times more money. He said, it's the hardest part of my job, defending that. I'm not going to do it anymore. I'm saying that we have to get down to business. And that's a great company. He's done a great job, and I appreciated it. And it really broke the ice because they were sending, well, we have to do research and development. Well, you have to do it for Germany and all these other countries too. Well, they think the United States should bear it. I mean, I heard this stuff and I finally said, it's over. Now, you have to have somebody that can get these countries to do it. I told them, if you don't do it, we're going to charge you a 25% tariff on everything you send into our country. That's much more money than what we're talking about. Then we have to get the drug companies to do it, and they'll do it because we have tremendous power over the drug companies too. So we're going to get it done. I just hope we get it done fast, Bobby, because this thing should go fast. But we're going to get the cost of medicine is going to be 1,000%. Think of that, not 2%. And I just tell this last story. When I was in my first term, in my last year, I was so proud of myself because drug prices went down for the first time in 28 years under my administration. You know how much it went down? 1/4%. And I was so proud of that. And I held a news conference, I think you'll be able to find it, congratulating myself and my administration because for the first time in 28 years, drug prices went down. 1/4%. That isn't tiny, but it still went down. And I thought it was great. And then I realized, you know, it's a very complicated business and formula. You got to be very smart. I said, we're really getting ripped off by the whole world. The whole world is ripping us off. And what happened is I got on this kick, and I got the drug companies to agree, and I got countries to agree. And they're not agreeing because they think I'm a nice person. They're agreeing because I will put charges and costs and tariffs onto them that will be many times more than what they're going to be paying. So the companies are there and the countries are there, and we got to get it done, Bobby. We got to get it done. And we're going to have the biggest price of it. Now, that's going to lower Social Security, Medicare, Medicaid. This is going to lower everything because drugs go for everything. It's going to have the biggest impact, I think, of anything that can possibly be done. But your costs are going to be going down for medicine, for prescription drugs, will be going down at levels that nobody ever thought possible. And that's going to happen in a matter of a very short period of time.
Very short.
And we're all set with the countries, and we're all set with the companies. That's all you need, the two. And the middleman gets cut out. Under this scenario, the middleman doesn't exist anymore. That was the other thing. They always blamed the middleman. I said, who are the middlemen? Nobody knew who the middleman was. You know, they had the most complex formula. It was genius, but they didn't get away with it. So